In this presentation, the topic on hemorrhage is discussed.
Namaste. Today we'll be discussing hemorrhage or bleeding and its management. Blood travels throughout our bodies through a series of blood vessels, and trauma of any form can damage these, leading to substantial blood loss. It's crucial that first responders are able to quickly and effectively manage bleeding, as it is the most common cause of death in the trauma setting. I hope that you find the following presentation helpful. Thank you.
Hemorrhage is one of the leading causes of preventable death, as death can occur within 2 to 3 minutes with heavy bleeding. Hemorrhage can lead to shock, which is a term used to describe a condition where there is decreased blood flow to the body's vital organs, such as the heart, lungs, liver, kidneys, and the brain. There are two types of trauma: blunt trauma that does not perforate the skin, and penetrating trauma, which can be caused by sharp objects cutting through the skin. Both of these types can lead to hemorrhage, which can lead to shock. There are many complications of shock. It can lead to organ dysfunction, such as liver failure, kidney failure, brain damage, and heart attack. It can also cause large areas of tissue death. Shock also leads to substantial loss of body heat, as adequate skin blood flow is necessary for our body to maintain body temperature. Shock also leads to coma, or a state of prolonged unconsciousness. And lastly, shock can lead to death. The signs and symptoms of hemorrhage include bleeding and bruising and symptoms of shock. The signs and symptoms of shock include an altered state of consciousness, restlessness or irritability, rapid breathing, rapid heart rate or pulse, nausea and vomiting, and pale, moist skin. It is important to know the normal range of vital signs for the clinical diagnosis of shock, which include a pulse rate between 60 to 100 beats per minute, a respiration rate of 12 to 20 breaths per minute, an oxygen saturation of 95 to 100%, and a blood pressure reading of 120/80. With hemorrhage leading to shock, a patient will likely have a pulse greater than 100 beats per minute, a respiration rate greater than 20 breaths per minute, an oxygen saturation below 95%, and a blood pressure reading below 120/80. The general management for hemorrhage includes the following. First, ensure open airway and establish breathing. Second, apply direct pressure at the site of bleeding. Third, apply a tourniquet on limbs only if bleeding is too severe to be controlled by direct pressure alone. Fourth, IV fluids should be given once hemorrhage is controlled to prevent shock. And lastly, the patient must be transported to a facility equipped with resources and personnel. This video shows the proper way to apply a tourniquet. The tourniquet must be pulled up while twisting to ensure adequate tightening. Here are some important reminders. Tourniquets should be 8 to 10 centimeters wide. Strings, ropes, and wires should not be used as these can cut the underlying skin. Always record the time of application and release of the tourniquet. One can loosen the tourniquet 1 hour later with direct pressure or retighten it if bleeding persists. One can also release it every half hour for 3 to 5 minutes. Frequently assess for changes in skin color, motion, and sensation. Here are some additional points to consider. Never apply a tourniquet over joints or apply it over clothing. Also, do not cover the tourniquet with clothing. Another tourniquet can be placed above the first one if needed. Lastly, tourniquets can cause major damage, so it is important to use it only in severe cases. For hemorrhage involving the head, neck, and trunk, the signs and symptoms include significant bleeding and signs of shock. Management includes removing pooled blood, applying direct pressure, packing with gauze, and securing with dressing. It is also important to avoid pressure dressings with open skull fractures. For bleeding from openings in the body, the signs and symptoms include bleeding from the nose, mouth, ears, anus, vagina, and the urethra, and signs of shock. Management includes applying dressing outside of the opening and not packing the opening with dressing, as this type of bleeding suggests internal hemorrhage. For impaled objects, the signs and symptoms include excessive blood loss due to the object being embedded in the body, and signs of shock. For management, apply pressure around the object. Also, never remove the object as it could be blocking a bleed itself. Internal hemorrhage is always assumed in patients who experience blunt and penetrating trauma. Heavy internal bleeding can deplete the body's blood supply and can lead to shock. The heavy pooling of blood can introduce pressure around the organs, thus, rapid transport to the emergency room is key. This must be communicated to the subsequent healthcare providers. The symptoms of internal hemorrhage depend on the type of trauma and what body part was involved. For example, abdominal pain and swelling can be caused by internal bleeding from trauma in the liver or spleen. These symptoms get worse as the bleeding continues. Blood found in vomit, stool, and urine are also signs of internal bleeding. Headache and loss of consciousness could be the result of internal bleeding in the brain. Lightheadedness, dizziness, or fainting can result from any source of internal bleeding once enough blood is lost. Any of these signs of internal bleeding after a trauma should be treated as a medical emergency. The injured person needs to be evaluated in a hospital emergency room. Management includes rapid transport to a hospital and also immobilization of fractures. There are important points to consider for the management of hemorrhage in children. For children younger than 15 years old, the management is the same as in adults, but caution must be practiced because symptoms of shock are more subtle in children and they tend to deteriorate more quickly. Here are some important points to communicate upon the transfer of care to the hospital. First is the mechanism of injury. Second is the airway, breathing, and circulation status of the patient. Third are signs of hemorrhage and shock. Fourth are tourniquet specifics, such as location, time of application, removal, and whether the tourniquet was effective. Lastly, events that occurred during transit must be discussed, such as the status and progression of the injuries. The appropriate materials and equipment needed in dealing with patients with hemorrhage include gauze and pressure readings, and materials for tourniquet application, such as a stick or a pen, an 8 to 10 centimeter wide band of cloth or ribbon, and a bandage to secure the twisted stick. In summary, hemorrhage is one of the leading causes of shock and preventable death. In managing hemorrhage, direct pressure is key. Applying tourniquets should only be used in the most severe cases. It is important not to pack gauze into a bleeding that comes from the eyes, nose, mouth, and other body openings. Do not remove impaled objects, as this can worsen the bleeding. Lastly, be cautious with children because they deteriorate quickly but show less obvious signs.
I hope you have found this presentation useful. Now it is time for you to practice these skills so you may be better prepared in an emergency situation. Please feel free to ask any additional questions. Thank you for your attention. Dhanyavad.